Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsor, Altman Health Systems. Today, Brad and I broadcasting from the administrative offices, and our special guest is Jillian Berkshire, APRN CPN. Now, you're going to have to explain it to me. Okay. And with Altman Oroville Carrollton Health Center. Good morning and welcome to the show, Jillian.
Good morning. I'm Jillian Berkshire. I am the nurse practitioner for the Altman School Telehealth Program, and we're looking forward to talking to you guys today about children's wellness and back to school
Good,
screenings.
good.
Excellent. We'd like to remind our listeners today our program's available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe to our program.
So, Jillian, tell us about yourself and your career with Altman and your current position.
So I started at Altman in 2012 as a registered nurse in the ER, and during that time frame, I did my nurse practitioner program, the master's degree program at Malone University. When I was completed with that program, I went to work for NeuroCare in Canton and got lots of neurology experience and have good relationships with those neurologists and just a ton of knowledge about the brain and spinal cord. And then I came back to Altman in 2019 at Altman Oroville Carrollton Health Center. Big fancy name, but we are the family practice office for Altman in Carrollton, Ohio. And then from there, about 3 years ago, we piloted the school telehealth program, which was a new initiative by the state to put school based medicine in each district.
Interesting. So today we're discussing childhood health and wellness. What is a child wellness exam about?
The child wellness visit is a comprehensive visit where we're looking at age appropriate developmental abilities and physical stature. So we're doing height and weight screenings. And the younger they are, it seems like we have a lot more questions because we're trying to figure out in a quick amount of time if they can do everything that they're supposed to be doing. And then as they get older, we're also discussing lots of prevention for each age level.
All right. Why is it important to get a child wellness exam when going back to school?
This summertime and back to school time is a good trigger to, oh, I need my exam because it's the easiest time for parents to schedule. When we're back to school, we're busy with sports and activities, and the evenings just and days, and we don't want to be missing school, do not allow that time as easily as in the summer. And when we do those exams, it gives the parents an opportunity to express any concerns and just get an overall making sure that our kids are on track for where they need to be.
Excellent. At what age should children get an annual child wellness exam?
So these wellness exams actually start as newborns. As your child's leaving the hospital, you set up with your primary care, and that's the start of these wellness exams. And they're really pretty fast, 2 months, or you have that initial newborn, and then you have a 1 month, 2 month, 4, 6 month, you get to a year, and then about age 3, they become annual, and then they just should go through into adulthood for each child, and it gives your child a good example of going to the doctor, making sure they're on track, and also it builds their confidence as they become an adult to be able to have those health conversations with a professional. And that's what we're working towards, is independence for our kiddos.
All right. So what about screenings? What screenings should children get before returning to school?
In this screening and in that wellness exam, we're going to measure their height and weight and check their BMI to make sure that BMI is in the average range. If it's too low, we're going to address those. If it's too high, we're going to address that. We're going to encourage healthy eating habits. Well, you're also going to get a hearing and vision screening. And then there's also some developmental screenings that are going on to make sure that are we cognitively, is our thinking processes right? Are we on track with our reading? Is our speech intact? And if not, then we can address those.
So, what vaccines are important for children to get, and at what age do they get these vaccines?
So the Ohio Department of Health for school admission requires that children have the DTaP, which is the tetanus, pertussis, and diphtheria vaccine, hepatitis B, the MMR, polio, and varicella before they enter kindergarten. And there's multiple of these vaccines, and that's why it's important to get those early on wellnesses so that they're staggered the way they should be. And if you're going to those wellnesses with your pediatrician or primary care doctor, they're going to be right on track to go into kindergarten. And then at 7th grade, they want to booster the tetanus, diphtheria, pertussis vaccine again. And then the meningococcal, there's 2 versions of that. The ACWY is required at 7th grade and then as seniors. And then the CDC recommends some additional vaccines like hepatitis A, Hib, rotavirus, many of the respiratory, so pneumonia, flu, COVID, and then also a second meningococcal for those seniors going off to college. And you're getting the whole gamut of what the CDC and American Academy of Pediatrics and the Ohio Health Department are requiring if you're hitting all those wellness exams.
You know, when I went to kindergarten or first grade in the last century, okay, I think we got 2 vaccines or something. Okay, something like that. So now it's just amazing to me how many injections and how many vaccines the children get, even the babies.
Yes.
How many they get. Now, how do we? Does the school do some of these vaccines, or is it on the individual's parents to?
It's on the individual parents, and they can get these at their primary care provider, or they can get them through the local health departments are also a good provider of the vaccines. Now that we have school-based health, we are working towards events at the schools to provide those required vaccines like the tetanus and the meningococcals for the 7th grade and 12th grade.
So I remember having a hearing test and an eye test, and you know, it's quite a ways back, so I don't remember exactly when they were given, but we still have to do that too, correct?
Yes, we do those in the visits, and then the school nurses are also completing those hearing and vision exams because they're so important. If we pick up on a subtle abnormality, we can address that early, and early intervention really helps children, especially with hearing. Hearing is really difficult to pick up on the subtle changes. So if we notice that a child has hearing loss, it can have an effect on their education, how much they're learning. It can also really affect their speech patterns. And then we have so many good ophthalmologists and optometrists locally. So when we pick up on those abnormal vision screens, we get them right off as a referral to those physicians and make sure that see if they need glasses or not.
Okay, I am sure that there are children who come to school without injections or without the whole raft of it. What do we do about that?
So there are some exemptions for those vaccines, but the school nurses are actually, that's part of their job in the early part of the year. They have to go through every student and make sure that they're up to date with all those vaccines. The state does have a reporting system called the impact system. And the nurses go through and they pull those up and they make sure that they're up to date. The parents should also be providing their vaccine records to the school. Most pediatricians, primary cares can print those off pretty easily for parents. So the nurses want the record, and then they have to make sure that that's in, I think, by mid-October. So you really want to make sure those are done and before school is started, so that the nurses can just go check your kid right off the list, and then, because if not, they will be calling you to make sure that you're on par with that, and then they'll send you to the same places we've discussed to go get them.
I see. Very interesting. Okay. What about the importance to have your child see a dentist regularly, and how often is regularly?
Regularly depends on your insurance. Most are every 6 months, some are only yearly. The importance is that our teeth actually can carry a lot of bacteria in them that can be spread all throughout the body. And it's also just basic hygiene practices. We want our kids brushing their teeth twice a day.
You're listening to Health Matters with the Medicine Center Pharmacy today. Well, welcome back to Health Matters with the Medicine Center Pharmacy. Friends, just a reminder to stop by the pharmacy and talk to our pharmacist about our Health Matters membership savings program. We want to help you stay well and save money. Okay.
All right. Did we cover dentists?
Yep.
We
covered
did.
dentists. All right. You know what? So my wife is a secretary at Perry Local Schools, and they had their open house last night for all the families and kids and all the nervous kindergarten parents and some nervous kindergartners. Can you talk to parents or caregivers on how they can help maybe ease a child's anxiety about starting school?
Yeah, so first, you should think about how you're responding to your child going back to school and how you're feeling. Acknowledge those feelings, maybe with you or another adult in your household, and try to work through those just to show your child that yeah, I'm feeling a little bit nervous about you going to school. I'm so excited, and always try to turn it to a positive for them. I'm excited for you to go and learn. And then identify like what is the stressor that your child's feeling? Is it the separation? Is it the new building? Is it for kindergartens? There's a lot of new. It's some of them it's the first time away from families or a certain caregiver. It's a new building. It's a whole bunch of kids. And then some older kids, it's the transition to middle school. It's just different. And some of it's just getting out of the summer that we've kind of been lax and now we're back to schedule. So helping identify what the trigger is, and then really just trying to be positive, encouraging that it's going to be okay, and there's lots of people and lots of adults to help you, and you're going to meet all kinds of good friends, and we're going to learn a lot. I think that helps a lot for students. And then those students that your child, you think, man, they seem to have way more nervousness than the average child. Give it a few days, let them settle in. I will tell you, now that I work with the schools, the first 1 to 2 weeks, everybody is like buzzy little bees. Like there's high energy, there's lots of excitement. It's a lot to take in, and then it kind of calms down. So see if your child calms down in those 2 weeks, and if not, then reach out to your primary care provider and say, hey, maybe we can just have discussions about, is my child feeling some anxiety or overwhelmed, and we're trying to work through it. Do you have any other suggestions? Good coping skills, breathing techniques, but just being an open dialogue for your student to be able to tell you what's going on.
Wow.
Well, you said schedule earlier in one of your explanations, and I'm thinking about how can we help a child develop a healthy sleep routine when they've probably been doing all kinds of crazy stuff over the summer?
Oh boy, sleep is a struggle. The average child needs 10 hours of sleep per night. So it's going to be individualized for each family. You have to think about your family, your child's activities. If you're one of those families that my child's not in any after school activities, it may be very easy to get a time structured schedule. 8:30, we're going to go to bed, or 8 o'clock, we're going to shower, and then we're going to read books, and then we're going to go to bed, and having a very time sensitive schedule. For other families, that time schedule does not work so well because of the activities their children are in. And it seems like the younger kids go later to practice. So just knowing that maybe your routine looks more like the habits that are being done before bed. So we're going to shower, and then we're going to brush our teeth, and then we're going to read, and then you guys are going to go up to bed and and sleep, and trying to get that done. And as soon as you get home from school, if they're getting back from those practices at like 8:30, that knowing that time frame's narrow and just trying to stick with it. That's also important. If you know that they need 10 hours, look at what time they need to get up to get on the bus and how much time they really need to get ready, and then backtrack. Where does that 10 hours put you, and are they getting enough? And then when they get days that they're off or that it's the weekend, they might need an extra hour or two of sleep in that morning just to recover from their busy week. So, and then you have family dynamics of they might live in different homes, or mom might have, or dad might have like a afternoon shift job. So there's all these factors to consider, but they really need 10 hours of sleep consistently.
Well, and you could probably, we'd probably be remiss too if we didn't talk about the screen time. So, it might be an idea too to, curtail that screen time an hour or so before bedtime to kind of help them calm down a little bit to get their minds at rest. Cause a lot of times that can keep you kind of dialed up, if you will, even for
Yeah.
you, even for us adults. So
Right. So good hygiene habits, hopefully our kids aren't getting very much caffeine, but even for adults, like cutting out the caffeine early in the afternoon, having that routine, avoiding any screen, TV, phones, the hour before bedtime. And then when some people wake up in the middle of the night, they quickly want to reach for that phone. Stay away from those screens because that blue light really triggers your brain to become active again. So trying to avoid that, which is so much harder nowadays when everybody has access to a
Hmm.
screen at their fingertips.
Gee.
So what about safe travel? What can we do to make sure children travel safely to and from school?
Okay, so if you're transporting your child on your own to school by car or truck or personal vehicle, then make sure we have our seatbelts. Wearing our seatbelts every time we get in the vehicle is super important to avoid um, additional injuries in an accident if there were one. On the school bus, making sure that the child knows the routine, the normal routine, getting on and off the bus, how not to trip on the steps. Some of those steps are pretty big for our preschool kindergartners. And then also, what do they do if the bus is in an accident? Do they know to get off the front or the back? And the schools are going over these with the students, but it's also good for mom and dad to randomly pop in, like, "Hey, what would you do if this happened?" And to talk about that. And then road safety, when to cross the street, what are you looking for when if you're a student that's standing out by the road, stay back away from the road as far as you can, a reasonable distance, and be looking at the cars and watching the cars go by. And then if you have concerns, reach out to your transportation directors. We had to do that for our own family, and they are fantastic. We found a workaround for our situation, and they were so easy to work with, and they made it efficient and safe for our kids. And nobody wants to see these kids get injured. And so if we can reduce that, that'd be great.
No, there was a horrible accident in Florida a couple days ago at a school where a parent backed over their child getting out of the vehicle. And even as I let somebody out of my vehicle, whether it's an adult or a child, I always make sure that they are out of the vision, are still in the vision, away from the vehicle when I pull out.
Yeah.
Uh, it just was crazy.
It's also considering that when we're parking at different events, like if there's an opportunity for you to be able to pull out of your parking spot instead of happening to reverse, kids are little, the kids are not thinking that you can't see them.
Yeah.
So also teaching your kid that the person in the vehicle may not be able to see you, driving slowly in those school zones and pick up and drop off. Like, yes, I know you're there to get your kid and you're in a hurry to get home or to practice, but those other children's lives are just as important. We have to slow down and pay attention.
Right. Okay. How about this, Jillian? How can people who need a primary care doctor find one who's accepting new patients for their children?
So we have altman.com. There's a tab for find a physician. You can go under the specialty tab. Once you click on that, you can go under the specialty tab, and there's an option for different specialties. You can click on family, and it'll pull up a whole list of doctors. There's also the altmandocs.com, and it'll show all the providers that are available.
Okay. So, what is backpack safety for children?
Okay, backpacks have two straps to use two straps. So we want one strap on each shoulder instead of just swinging it on one shoulder.
I see.
It's
Okay.
used to distribute the weight evenly across the back and not just on the shoulder. We also want to make sure they're not too heavy. We like to cram as much as we possibly can in those backpacks, but sometimes that stuff's not all necessary. So just the necessary stuff should be going back and forth. Try to get the stuff that's the heaviest down in the middle and the center of the backpack so it's distributed more evenly, and then make sure those straps are tight on the backpack.
And how can parents establish good homework and study habits?
Comes back to a routine. So the more you can get on the routine and your kid knows the expectation is at this time we are going to do the homework and we're going to study, and that education and reading are so important to our family and we're going to work on this, then I think it makes it a little easier to get those habits going.
I
Okay,
think it
go ahead, Fred.
No, I was just I think it kind of helps too. Like you talk a lot about routines. I think a lot of times too they're like situational based. So, if you come home from school and the first thing you do is sit down at the kitchen table and you have your snack and then you do your homework. I mean, then, when you're at the table, it gives you like your place to be in that frame of mind. Sometimes little things like that help before you get sucked into going and turning on the TV or picking up your tablet or whatever.
Yeah, absolutely. And then just holding them accountable, like, hey, why are you on that game? And then just acknowledging, like, is whatever chores or whatever your household routine is, did we start on homework? Do we have homework? And you have to have that conversation every day. You would think you always want to be like, oh, they have it taken care of. Yeah, they might, but they probably don't. So just go ahead and ask them, do you have homework? And what can we work on together to get this done so we can move on to the next thing?
Yeah, because who doesn't want to have more fun than do work, right? So
Right. And it is hard to think that they like spend a whole day in school and then they got to come home, and sometimes giving them that snack or that like 10 or 15 minutes of downtime, they just need to recoup and then say, okay, let's get into our homework so that they're not just going from school back into work, because then they kind of feel extra pressure, like I didn't even get any time off, or I didn't get to relax.
So it is the bottom of the hour and time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, we're talking with Jillian Berkshire of Altman Orville Carrollton Health Center. So,
okay, let's talk about food. So, how important is it for your child and adult to eat breakfast?
Our brains require energy to function. So if we're gonna go to school and learn for 8 hours, there's several hours before lunch occurs. So we definitely want to get a good breakfast. It also helps our attitude. Usually if we're hungry, we're a little grumpier or maybe not quite encouraged to pay attention or listen. So if we make sure their bellies are full when they start off the school day, we're just giving them a good start to the day.
Do you have any tips on what a healthy breakfast looks like? And one of my favorite Calvin and Hobbes cartoon strips was where he would eat chocolate coated sugar bombs. And so all I can think of is that all the cereals, you walk down the aisle and it's like makes my teeth cringe kind of thinking about how much sugar's in some of that stuff. Do you have any tips on what a good idea might be for breakfast for a kid?
Yeah, so good idea. A couple, and this depends on the size of your child, the age of your child, but a good source of protein, whether it's like a sausage or a bacon, eggs, some toast, and then some fruit. But we also have to remember that with the way families are, sometimes it's the affordability of these things too. And so if you can provide your children these things, fantastic. Obviously, get up in the morning, get them a good breakfast, get them a good start, try to find the things that are most nutritious. But some families struggle with this. And so any breakfast is better than no breakfast. And fortunately, a lot of our schools have resources that have been trying to help assist with breakfast. And so your school district might have a free breakfast option. So checking with that if you're in need, and some just offer it to all the students. So it just kind of depends on the financial needs of the district, but definitely want those bellies full so that they can have their best opportunity to learn.
now Jillian, is the breakfast at the school a hot breakfast, or is it just like a cereal and toast, or don't you know?
It's usually like a breakfast bar or cereal. They do usually have a fruit option with it, and then a juice or a milk to go along with that.
Okay.
And again, that's district by district how that's provided. I think some of the older grades in those districts that are providing the breakfasts is that they do have a hot lunch version for the older kids. So also teaching your kid, that gives an opportunity to teach your kid to, like, even if they're getting the sugary breakfast, to at least be talking about, like, hey, how much sugar does that really have in it? Because some kids are really misunderstanding, like they think that a bar doesn't have sugar in it, and when you're like, oh, let's compare that to candy, and then it just starts opening up those conversations too, so that they can recognize that, oh, there's a lot of sugar in there that I might not always need.
Wow. Okay.
We talked a little bit about sleep schedules and stuff. Do you have any tips to help develop a consistent bedtime routine for a child?
Yeah, it's going to be the routine, not so much. I mean, the time is important, but the routine is just as important. So we do like shower, brush your teeth. It's got to be a calm down period. So yeah, get the TV off, get away from the TV. By the time they shower, you got 10 or 15 minutes there, brush teeth, a few more minutes. So you're already working towards at least a half an hour away from that screen time. Taking some time to just connect as a family, talk about the day, good things about what tomorrow will bring and how tomorrow can be better, even if today, we might have had some upsets or struggles, but tomorrow is going to be fantastic and we're still going to have an opportunity to learn. And then try to go to bed without big stressors. Like, we don't want to be talking about the things that are really going to weigh on a child as they're going to sleep, because this is their peaceful time. This is the time they should be trying to relax so that they can get a good night's sleep. The less stress they have as they're going to bed will also factor into a full good quality night's sleep.
Okay, now every child down to age of 0 has a phone. Okay, do we allow them? Do we allow them to take it to bed with them?
No, I would get rid of that phone too. That's part of those screens. So, and honestly, I would probably just have a place in the household, like a communal place that it gets put. Some kids unfortunately just have that, they just can't resist them type of personalities. And so they will kind of try to sneak around and find them whenever they are going to bed. So then sometimes maybe they need to be locked up. But just keep those screens away from your kids at bedtime. They really need to go to bed without a screen, a TV or a phone.
All right, you mentioned part of the nighttime sleep routine is healthy hygiene habits. Can you speak to some healthy hygiene habits?
So we want to make sure we're getting a bath or a shower every day. People sweat, people run around and play. Little kids love to roll on the ground. And it is a struggle for, I don't know. I have boys. So the boys are very resistant to wanting to shower. Like, then when they get in there, they want to spend forever in there. So I'm like, just take the first steps to get into the shower and then you'll be good. And wash all the important parts, especially, you want to talk about washing the whole body, but also the important parts. What doesn't get washed might be itchy in the morning. And then brushing teeth twice a day. For girls, and children with long hair, we want to make sure the hair is getting brushed and cared for. Deodorant, those sorts of things.
Okay. We've talked about screens a lot during the show. Do you have any recommendations on limits for screen time or best practices?
Yeah, we definitely want to aim for less than 2 hours a day. And it's so important to just get out and enjoy life away from the screens. 2 hours is plenty of time. And if you can even get 2 hours and with school and activities, that's probably a lot for the day. But yeah, less than 2 hours.
Okay. When I was a kid, we didn't have a phone, obviously, and we played outside, and all summer left in the morning, came back for lunch, left again, came back for dinner. Okay, so what can we do to get children to increase their physical activity these days?
One, making it, maybe they play outside for that hour before they get on the screens. Make it like the reward system, like, oh, play outside. Playing outside is so peaceful for the brain, like to enjoy nature and the fresh air and the grass and the things you discover and imagination, free play. It's all so important to the well-being of the child. And then they can have their screen time. Also making it a family thing. It can be a time when you can just enjoy your children's time and what's going on with their day. Go for a walk. It doesn't all have to be running. You can go for a walk. You can go to the local playground, and just get out and do it together.
Okay, so if your child is feeling sick, what should you do?
First, think about, hopefully they need to tell you. So encouraging them to tell you when they don't feel good. There's so many times we start visits and the parents like, I had no idea they weren't feeling good for 3 days. They just told me this morning. It's pretty normal. So just encouraging them, hey, if you're not feeling good, let me know. Once they tell you they're not feeling good, what's not feeling good? Do you have a runny nose, a little cough, sore throat? Can we try to like watch it and see if over the counter things like ibuprofen, Tylenol, allergy meds would those be appropriate? They have on the medications on the back, they all have dosing, and I'm sure your local pharmacist would be able to help you if you have questions about some of those meds and if your age for your child is right. And then from there, if you're like, man, there's something, if they're vomiting or they have a fever or the symptoms are worsening, then reach out to your primary care provider, reach out to your school nurses. With our school telehealth programs in the schools can offer those. And then you also have your STAT cares. We definitely want to leave with the ER for real, the more severe emergencies, major accidents, if your child's struggling to breathe, if your child's very lethargic, absolutely go to the ER. But if it's something more mild and you just need some assistance with the treatment, then go to your primary care, go to STAT care, and reach out to your school nurses.
Do all schools have a school nurse?
Yes, all schools have a
Okay.
school nurse
All day?
all day. Yep.
Okay. And they can treat what?
They can't treat because that's not in the scope of a nurse. They can assess and they can give you guidance on where to go. So my child has a sore throat. Okay, well, we got to think about things like strep throat. They're gonna say these things to the parents. And they're gonna say, the over-the-counter treatments, ibuprofen, Tylenol, and then they're gonna say, hey, you need to make an appointment with your primary care. You can make an appointment here at the school, or you can go to STAT care, but the child really should be seen for this. Or if they're having ear pain, you think it's an ear infection, they're definitely making those recommendations to get what they need so they can get the prescriptions they need.
So it's hard to believe that every school has a nurse. I remember, I do remember in the past that some of the school systems had a nurse that kind of went around to the schools. But is that required now by the state or something that
Yes,
okay.
because they're really they're managing. And honestly, until I did the role I'm in now, I thought the school nurse was like the easy nursing job. And it is so far from that. They're responsible for, I mean, sometimes it's one school nurse or sometimes the districts have multiple nurses, but the amount of people and staff that kids and staff that are responsible, you have 1 to maybe 800. That's a lot. And they're checking vaccines and making sure those are up to date. They're making sure the hearing screenings and vision screenings are done. They're doing those lice checks, unfortunately. They're also the direct source for when someone's not feeling well. They're going to that school nurse and saying, I don't feel good, and then looking for guidance on what to do next. So that school nurse job is a heavy load to carry, and definitely we shouldn't be taking them for granted because they help our community so much.
Well, I know there are students who take meds through the day in school. Now,
Yeah.
does the school nurse supervise that and hold the
She both
meds?
she both gives it and supervises it because some of the districts are still, many of them have consolidated into one campus or two, one campus with 2 building type scenarios, but other districts have multiple buildings so that are spaced out. They might be a 15-minute drive from one to the next. So she definitely has people that she has trained that are approved by the school system to give and assist with medications. But yeah, we have our type 1 diabetics that require insulin. There's also children that require tube feedings. The needs of children that are in school and have access to public education have really increased also. And I think that's also part of the dynamic that a lot of people don't consider when they have children that don't have any of these needs, that the higher healthcare needs that the school nurse is responsible for.
Okay. Our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
Are you frustrated with the cost of prescription drugs? By now, you know that your insurance price isn't always the best price on your medication. The new Health Matters drug plan is a simple, easy way to save money at your local Medicine Center Pharmacy. No need to visit GoodRx or Single Care, disclose your private information, or print out coupons. Just talk to one of our friendly staff members and ask for the best price. It is that easy. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia, and online at medshoprx.com. Hi, Paul White here at the Half Off and Out Buy store in Louisville, and we're stocking up on new merchandise, and we need to clear out some old. This week, 20% off on all pools, rafts, and summer toys. Also 20% off on tents, air mattresses, coolers, and so much more. We also have you covered for back to school. We have backpacks and school supplies at super low prices, as well as our everyday super deals on readers and sunglasses, just $1.69. We're located next to the Medicine Center Pharmacy in Louisville. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out Buy store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out Buy store in Louisville, next to the Medicine Center Pharmacy. The Medicine Center Pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, medshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Okay, welcome back to Health Matters with Medicine Center Pharmacy. I am your pharmacist, Paul White, pharmacist Brad White, and I thank you for joining us. Let's get back to the last segment of the show.
All right, so we talked a lot about what to do if your kid's feeling sick. How about what options are available for kids who are sick?
So first, reaching out to your primary care provider. We also have our Altman Now urgent cares in multiple locations, and we have a virtual Altman Now system for if the urgent cares aren't available. And then also we have the Altman ERs at main campus, Orville, and Maslin that are available for those big emergencies and more critical situations. And then we have our school telehealth programs that are in 12 districts. We have Canton City, Minerva, Malvern, Carrollton, Sandy Valley, Tusky Valley, Claymont, Rittman, Waynedale, Orville, and the Wayne County Career Center all have options for the telehealth services, which is a virtual visit. They go down to the school nurse, and the school nurse contacts the parent. And even when consents are signed, the school nurse always reaches out to them for a visit beforehand. We have these really cool carts where we can listen to heart and lungs, look in their ears and the back of their throats. And then it gets run through insurance just like a normal visit. The parents are involved either on site, virtually, or after the visit. So it's a great option. This is all done right at the school, and it just takes a few minutes, and then we can send prescriptions right over to the medicine shop for them if they need to. Labs, x-rays, wherever, can get sent wherever they prefer.
So what about when I was in, I guess, grade school or whatever they call it nowadays, physical education was required in the school for a couple of years. I can't remember when it was. What about nowadays?
Mo
Physical ed. Go
Yeah,
ahead.
all the schools are still getting, as far as I'm aware, they're still getting that gym class. It's not every day. It's usually like once a week. The younger kids are still getting a recess where they can freely run and play on the playground, which
Hmm.
is a great opportunity for that physical. And they just need the time away from class. They need the time to run and play and come
Mhm.
back to learning.
And what about the high school age?
The high school is still getting a phys ed requirement.
All,
But it's
all,
like a half a year thing, I think now. They
so
do like
it's not 2 years
no,
or something like that.
no, it's not as much as
Okay.
even we did in school.
Okay.
No
Interesting.
more presidential fitness tests or anything like that. How many pull-ups can you do, right?
I think they do it like more. I don't know if it's just fun or if it's required. I know my younger, because mine are elementary, they still did like some of that stuff last year,
Hmm.
but I don't know if I don't think the older kids are meeting those.
Hmm. I know there was always a complaint that they had to take a shower afterwards or something like that in certain grades, and I can't remember where that was.
Yeah, I
It
think in high school they really used to push that before. I hope they
uh,
still encourage it, but I don't know how much it's enforced
yeah,
nowadays.
right.
All
Okay.
right. Well, great. So
Does the nerd
Jillian, do you
does
have I think it'd be helpful. You mentioned some resources for people to get care for their kids. So if you could run through those again, and if you have any phone numbers or websites to share, I think it'd be helpful. Before the program, I mentioned to you that I had a parent in the store just yesterday who was they knew how to access care, but they didn't want to go to the ER because they know that that isn't always the cost effective way, and it wasn't a major issue like you described in your explanation. It was, I think that they thought the kid had COVID or the flu. So what do you do if it's after 8 o'clock at night and maybe the urgent cares aren't open, but you can look for some resources to be effective?
Yeah, you can go to the Altman Now online and it's available 24/7 and they can definitely take care of those more minor illnesses and bronchitis, cough, cold, flu type
Mhm.
symptoms. And then, if you're in one of our districts with the telehealth services, you can reach out to your nurse first thing in the morning and she can get you usually scheduled for a visit that day too. So it's just on what you're feeling like you need. If you really need something that night, the Altman Now is definitely there to be a great service and a great addition to the urgent
Mhm.
care type visits. And it's virtual, and you can do it right from your home. And then if you want to wait and do it with your school nurse and our telehealth program, we're an option for you also the next day.
Mhm.
So.
Could you give a brief explanation of what that might look like for someone who's never done a telehealth visit?
Yeah, so the standard telehealth visit, with the Altman Now, you usually have to click in and answer a couple questions. There is a small fee for that visit, and then you do like FaceTime. Most people have done FaceTime, so it's just you connect audio and visually with someone and with a physician or nurse practitioner. It comes up on the screen. There's who's ever available. So there might be 3 providers available, and they'll tell you like how many people are ahead of you, and you click on that person. Or there might be 8, and then a lot of them have no one ahead of you. You just click right on it, and then you have that discussion about your symptoms, what you're feeling, what's going on, and then they decide on the treatment plan based on what you're telling them.
Mhm.
And then the prescription gets sent to the pharmacy of your choice right from that visit, and then you go pick it up. And they're
Mhm.
pretty quick visits.
Okay. Okay. I guess we're about out of time, aren't we?
Yeah.
Very, very interesting conversation today, and it's been a long time since we had an individual on the radio program that could tell us about the schools, because there's so much stuff going on in the schools that is different, changed from when I went to school a long time ago. So,
Yes. The schools are always adapting to new scenarios, and they're a big hub for our community and taking care of our kiddos. So we definitely are glad to be there.
any last words you have, Brad?
No.
Okay, doke. Thank you, Jillian
Thank
Berkshire.
you. Have a great
Certi
school year.
certified nurse practitioner from Altman Orville Carrollton Health Center. You suspect you have a medical issue, please contact your healthcare provider. Thanks to Altman Health System and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. See you right here again next Friday on News Talk 1480 WHBC. Thank you again, Jillian.